we are very interventionalists, and to me, to my eyes, cavalier about how we prescribe things a lot of the time. I'm often, when I train the residents, I'm like, okay, when someone's adding on a third or a fourth or a fifth medicine, could we step back and consider maybe that medicines cannot solve this problem and that medicines have failed, right? Wouldn't that be a more reasonable thing to at least consider than yet another medicine is going to solve this problem?
That statement, the science is settled. What is settled? I don't even know. That's an oxymoron, no? Settled science?
That's the opposite of what science is, to say something like that. Sperm counts are down. We know that there's ecological damage due to estrogens in the water. We know that a lot of our plasticizers and other chemicals are getting into our systems and affecting you. The Endocrine Society themselves did a review. I think that was the 2012 review where they talked about how reproduction could be affected. And why are they need to be so authoritarian if they think they have the facts on their side? It's pretty amazing. It seems a little strange that you'd want to clamp down on this discussion if you feel like the facts are on your side.
Hi, thank you for joining us. I'm Natalia Maratford with Restored Childhood, and I'm really pleased to welcome Dr. Kristopher Kaliebe to our conversation this morning. Dr. Kaliebe is based in Florida. He's a professor of psychiatry at the University of South Florida in Tampa. He's board certified in psychiatry, child and adolescent psychiatry, and forensic psychiatry. He's a distinguished fellow at the American Academy of Child and Adolescent Psychiatry. And from 2013 to 2021, he served as the co-chair of that organization's media committee. So he's been writing about gender medicine, but also other issues for many years, and is a professor and works in clinical practice. And I'm really glad that we connected, and I'm happy to have him here. So thank you for being here.
I'm glad to be here. Thank you for listening.
By the way, your article was one of our most viewed and shared articles ever. I think it really spoke to people. I've gotten a lot of calls about it, both from parents and from people in, parent advocacy who've been very interested in connecting with you. And we're really grateful for your voice, very reasoned and balanced and important. So thank you very much.
It's sad an article like that had to be written, but unfortunately we're at a place where we need to, reframe what's going on in our society and take on some of the problems, that we've created. So yeah, I was hesitant to get involved with the public dialogue because I'm mostly an academic and a clinician, and that's not a space that I have been in really until now. But I feel like I had to speak up.
And what is the space, and how did you get into it? If you could just bring us back.
I'm going to frame a little bit about my career so people have an idea of, what my experience and training is, and also a little bit about me and my perspective. I started medical school in 1995. I did child psychiatry, forensic psychiatry, and adult psychiatry. So I'm boarded in three, I have 3 boards in psychiatry. I mostly have practiced as a child psychiatrist. I do some forensic work. I do adult work also, but I mostly identify as a clinical child psychiatrist. I've always worked at universities, and I've always done a lot of teaching. I love to teach. I'm very involved with teaching. I was the training director for the Child Psychiatry Fellowship Program when I was at LSU in New Orleans. I spent 14 years overall in New Orleans, and now I moved to Tampa, Florida. I was recently promoted to professor. I have years of excellent feedback from medical students and residents, and I go out of my way to cultivate a thoughtful approach to psychiatry. I will also highlight, though, that I've been a little bit of a skeptic along the way. So I didn't have some moment of rejecting these things. I presented 2 times at the Preventing Overdiagnosis conference, been very involved with the complementary and alternative medicine group, which is really for me more like the basics of health, nutrition, physical activity, exercise. I'm a big proponent of mindfulness and yoga. I think that we often in medicine can be very interventionalist. So I come from a viewpoint that we often cause iatrogenic damage, and I've been saying that for a really long time. And then to me, gender medicine was the place where I've seen that, to a degree, be way beyond anything I'd seen before. And while I'm a generalist, it caused a lot of concern and kind of pulled me in. So I wasn't, I of course, over time, I went from going to medical school and then moving to Florida, 1995 to 2016. And I saw zero patients expressing gender dysphoria for all that time. And now, you'll show up at a clinic and have a number of patients, even in a single clinic, expressing gender dysphoria. So clearly, just my lived experience tells me that something has changed. Meanwhile, one of my interests is the media. So I was a chair of the media committee, and I think everyone is aware that there has been a lot of social influence in disorders in psychiatry for a long time. It's well documented. The social influence on health. You can't look at the data regarding gender dysphoria and not come to the conclusion that this is to a large degree a socially mediated phenomenon. And so, once again, I have that media experience, which I see it in other disorders. And so that also served as a comparison, and also why I felt I needed to speak up, because I know more about media influences than most psychiatrists.
So when you say speak up, how did you speak up and when?
2 years ago, I applied to do a presentation with Rita Katiala, which I'll probably not properly pronounce that name, and Lisa Littman at our Child Psychiatry Conference. So that was my first submission for something related to gender dysphoria. I was hoping to, have a small group discussion. They had applied to come for a research symposium. This is not the conference that's happening in a couple of weeks, but it was last year's conference. But it was about 2 years ago when we submitted that. So I submitted, and we also submitted for a research symposium that year. I wasn't involved with it, but I knew it was being submitted, and both of those got rejected. And I've also saw the level of scholarship in our journal with some editorials that were frankly, dysfunctional. And I wrote a letter to the editor about that time with a couple other child psychiatrist colleagues. It got rejected. It didn't even get sent out for review. I've sent some other letters to the editors of that journal and other journals. They get rejected. I wrote a piece for the American Academy of Child and Adolescent Psychiatry newsletter saying I believe we're too politicized and too ideological. It didn't get printed. And, I've experienced publishing in these same journals and writing in ACAP News before. Every other time I handed them something, it got published. So this year I submitted with the head of the Finnish gender service, who is one of the world's top researchers in gender, a gentleman from Sweden who did his dissertation in 1999 in transsexualism and was part of the review of the country of Sweden regarding hormones in children. So he was part of their systematic review. And a researcher from Oxford who's very erudite and is published in this area and has a strong reputation. So we had 3 international experts for a research symposium. And I asked the person who's the head of the gender committee at ACAP to be our discussant, because I knew that his perspective was different. But I thought it'd be great. We'd have someone who could come in and, he could ask some tough questions and we could have a real honest, rigorous dialogue. He declined. He also didn't suggest this for anyone else, which I've been a committee chair for 8 years. So if someone comes to me and wants me to be in a presentation and I can't for whatever reason, I would always hand that to someone else in the committee. I mean, it's discussant. It doesn't even take any work. You just show up and ask questions. I mean, it's a it's an honorary, and you're on the stage at ACAP. But he didn't hand it to anyone, nor did he agree. So we did get a past president of the American Academy of Pediatrics as our discussant, and we got rejected. And we had a similar proposal, which was not a research proposal, but we had all the people from the different countries, a different person from England, that were going to talk about the changes in their system related to how they're handling, gender dysphoric youth, because each of these three countries is now, sort of moving away from gender affirming care. But that one was rejected too. So I'm giving you a little piece of why I got to be writing this article, is that if you look at the quality of what they are presenting in our journals and at our conferences, I would say any objective observer would say those presentations are pretty low quality and all are saying the same thing, yet they're rejecting actual scholarship and real rigorous dialogue, for what you'd have to ask them what the reasons are. But to me, it's contrary to everything that I was taught about how medicine is supposed to work.
I mean, this happened during COVID as well. We had false narratives. We had citizen scientists like Kelly Kay out in Georgia correcting the CDC's mortality numbers. She's still doing it. But at any time doctors spoke out, institutionally affiliated doctors, they get like harangued and brought in and spoken to because they were diverging from the narrative and working on shattering this false illusion of consensus. I mean, look at what happened to Jay Bhattacharya and Martin Kulldorff and Sunetra Gupta, some of the top researchers in the world who were discredited by our NIH director and Anthony Fauci. So this just seems to be like more of the same effect, where there's a narrative, the evidence doesn't support it, and any researcher or medical professional who tries to speak out against it is censored. Well, have you faced any personal backlash? What have been the consequences to you for speaking out?
I've really not. I think in some ways I'm relatively insulated from that. I mean, for one, my pedigree is strong enough within child psychiatry where it'd be hard to pigeonhole me as some radical or far-right conservative or any of that. I mean, if you look at what I've published, it's mostly about working in primary care and doing what's called collaborative care, where specialists come in and work with the pediatricians and family practice docs to deliver high-value, effective care. And I'm a member of the complementary and alternative medicine, community. I have years of great feedback from residents and medical students. No, nothing has happened to me. I'm also somewhat insulated. I mean, I actually think it's a real privilege to have been at what I think are great institutions, but also not part of the bubble, because LSU in New Orleans is certainly a great medical school. We had a great department. We had some real, people who are very prominent in the National Child Psychiatry Association, but we were not like really in the bubble. So we were free to do whatever we wanted, and free thinking wasn't punished or I mean, just contributing. People were excited when someone was doing academic work and contributing. And I feel, and I have a great department at the University of South Florida. I feel very supported. Everyone is like, do your thing, whatever you want to do. So personally, I have not there. I don't know, anything. I don't know what people say behind my back, but I am pretty confident that I have maintained, a good reputation and a good relationship with people inside any of the institutions that I'm actually working with. I don't know how things seem or feel on the other end at the place, which is my sort of professional home, the American Academy of Child and Adolescent Psychiatry. I had at least one somewhat unpleasant talk with one person there, but I've had mostly cordial interactions with people, and they say, "Oh, we take science seriously, and we want to, make sure that we are trustworthy and all this kind of stuff." Although I haven't seen action, but that's what I've heard.
But I think in your article, you talked about the fact that like the censorship, the lack of openness to dialogue is not something that like the rank and file members espouse. It's kind of coming from the top down. Do you believe that's true?
Yeah, I mean, I think you do have to look, and I'm going to step away from my particular organization and just say this whole Jonathan Haidt's idea of structural stupidity like really rings true. I mean, you get a relatively homogenous population, and especially in this case, I mean, I'm not a defender of the right or the left, and I try to take everything in the middle, but most psychiatrists are on the left, and most child psychiatrists are more on the left. And then when you take the leadership, they come from elite institutions usually. So most of the people are from these elite institutions. And so, yeah, the difference between the people who are in leadership at ACAP and like your regular child psychiatrist out there in the world working is, significant. And I think that unfortunately leads the leadership to be very wanting to be involved with stuff that's outside of the field of psychiatry and beyond our scope of practice. So we've continually taken like left-leaning stances publicly on all sorts of stuff, which I just have always been concerned about, because if anyone knows anything about science and how the public interacts with science, Dan Kahan has a lot of he has nice articles on this. I mean, we can't convince people when they believe the institutions are captured by the left. And so, all we really need to do and should be doing is trying to make very trustworthy institutions that everyone knows we play by the rules and we're not captured. We should be very concerned with our own reputation. However, we seem incredibly willing to delve into things even outside of our normal scope. And then now we have something within our scope, because certainly gender dysphoria treatment is within our scope. But I think any reasonable person would say, well, the same organization who's continually taking these stances on issues that are beyond the regular scope of child psychiatry, how would we trust them? And so, yeah, I think we've delved into this, area in a way that was not very mindful of those dynamics. And I think we've shown ourselves not to be capable of having a regular, rigorous scholarly discussion. And yes, I think we've achieved structural stupidity at ACAP and within a number of the universities. A lot of the more prestigious universities are all the more authoritarian and stifled. And I would say, well, why are they need to be so authoritarian if they think they have the facts on their side? It's pretty amazing. It seems a little strange that you'd want to clamp down on this discussion if you feel like the facts are on your side.
Their version of morality, right? It's not science. It's follow the science. It's not follow the science. So that's not what science is. And science is always evolving. It's kind of like I keep hearing that statement, the science is settled. What is settled? I don't even know. That's an oxymoron, no? Settled science?
That's the opposite of what science is, to say something like that, right? I mean, it's just no.
Right.
Everyone knows. First of all, there's no authority on any issue that runs the issue and is going to tell you what the science is. It's always competing dialogues, and everyone is free to raise questions and ask for data to substantiate things. And if we're going to be honest, I think we all have to accept that we're just, slightly evolved primates, and we mess things up, and we're very tribal, and we do stupid things, and we all have to be humble. And that's kind of how the scientific dialogue traditionally helped us remain humble, because it was people would write something in a journal. You'd have to wait a couple months for the letter to the editor, but it'd be, and it did put in mechanisms based on the technology of the day where you would cool down the emotions, and the tribalism was less, affecting what was going on. And unfortunately, I think technology, especially social media and, Twitter mobs and all this kind of stuff, has weaponized moral outrage on all sorts of subjects. And people kind of know they can get their way by pushing and bullying if you get enough people together online. And so it seems like researchers and regular clinicians and most people don't want to get in the middle of that. And so it creates what is called a spiral of silence, where most reasonable people in the middle are sort of saying nothing, because who wants to get in the middle of all that?
So interesting. I like all of the weaponized moral outrage and spiral of silence. See that across many different issues. Child masking, what happened with the AAP on child masking? They went and they deleted pages that said that it was important for young children to see their caregivers' mouths move, which obviously it is. Like, we don't need science actually to tell us that. We are primates. Primates need to see each other's mouths move. So I agree with this. I think it's still happening. Certainly, we saw it during COVID, and the CDC lost a lot of trust, even I think amongst people who won't admit it. I think it's been weakened very much by the controversies and their flip-flopping and this just like kind of narrative that whether you are on the left or the right, I think any relatively smart person saw that it was politically motivated. I think out of the decay rise, the phoenix or whatever it is, and we do have new organizations that are rising up, and speaking out and putting together conferences and bringing doctors together. I think one of those is Do No Harm, which is really kind of, ascended very quickly, and is specifically interested in evidence-based gender medicine and a few other issues. But I think you were here for SEGM, and I wanted to ask you a little bit about that. What does it stand for? Who are they, and what are they trying to do? And what was the conference like?
So yes, I was last week in New York for the Society for Evidence-Based Gender Medicine conference, and I think it's a wonderful organization. In the title of the organization, it tells you something: the Society for Evidence-Based Gender Medicine. It is not an ideological or religious association. It is not a attack on people who are gender nonconforming or have gender dysphoria. It is a attempt to turn the discussion towards high quality care in this arena. And sadly, we've delved into what I think any reasonable observer would say is ideologically based care. The ideology drove the care and drove the suggestions from the community. And unfortunately, that's not good for people. It's not good for medicine. And add back to our previous conversation, because the institutions are so captured by that ideology, and you can't get letters to the editor, and you can't get articles in, you can't get presentations at the conference. So now we have to create new organizations and structures in order to actually have the dialogue. And thankfully, because the presenters that I had asked to come had carved out time in October to come to New York, we brought in, the Society for Evidence-Based Gender Medicine is really a worldwide, group, and they had people from Australia and obviously, as I mentioned, England, Sweden, and Finland. And they also, we had Hannah Barnes there, who talked about her wonderful book. Time to Think is a really powerful, great book. And that, if people are interested in sort of catching up on what's going on and the controversies, that's a great place to start, or to add to, your understanding of where we're at with gender these days. So yeah, great conference, great people, perfectly reasonable. I'm sure there will be, people will, rather than actually dialoguing with the ideas as we're talking about in this sphere, people want to make like moralized attacks and attack the credibility of these scholars, because it's hard to actually talk about the facts, because the evidence-based medicine group has facts on their side, so they don't need to shout or yell or call people's names. They just need to direct us to actually do proper care and to justify our care with evidence. And like I said, it was really nice. And I think for those of us who are kind of feeling a little bit unwelcome at other places, it's just nice to get together with people who are like-minded. And it was an incredibly diverse and bright group of people.
What was discussed that was new and different and surprising? And along those lines, what will you talk about, like, was endocrine disruption discussed as a potential cause? I think you were mentioning that at our dinner the other night, and that's an area of particular interest to me. So if you could share some of that, that would be great.
I will talk about endocrine disruption, but it wasn't a feature of the conference. But we all are wondering, I believe, in our modern society, we already know, sperm counts are down. We know that there's ecological damage due to estrogens in the water. We know that a lot of our plasticizers and other chemicals are getting into our systems and affecting you. The Endocrine Society themselves did a review. I think that was the 2012 review where they talked about how reproduction could be affected. I mean, so we have a lot of good evidence that we should at least be concerned that endocrine disrupting chemicals are affecting our bodies and our reproductive systems and our sexuality. So yeah, it's fascinating that no one is studying that and no one's talking about it in public, because it seems such an obvious thing that we should look at.
Why aren't they studying it? I mean, we have lots of environmental health, pediatric environmental health experts. This would seem like a natural area to explore.
I think anything related to sex and gender is a third rail for people, and potentially career damaging. And so I think that I can only imagine that I cannot see any other reason that has really prevented this whole line of research from moving forward. And how come it's not talked about in the journals? I mean, it's pretty amazing, right? It's in stark contrast to how we look at other problems. This one is not really being assessed even on a basic science level. I will say we had a great presentation on puberty blockers from a neuroscientist from England who does research adjacent to this, lots of like adolescent and development brain researcher, one of the world's top. And she went over the evidence related to puberty blockers, including evidence that perhaps, they definitely are not reversible. I mean, this is a fiction, right? You can't block someone's puberty and then go back in time. Things are not happening. And one of our concerns is IQ. So there is a possible negative, impact on IQ. And the really long and short of it, just like almost everything with these things, is that we don't have enough data, and people don't even really seem to be studying it, especially as they're rolling out these, basically untested interventions. We're not even tracking. So right now, I don't really know that we're going to be getting those answers unless we start tracking, neuropsychologically before and after on any kid that goes on those.
I have the same or similar concerns about all of the psychiatric drugs we give to children very early on in life as their brains are being developed. ADD meds, stimulants, antidepressants, medications like Abilify, I think that have black box warnings that may not impact adults in the same way that they impact the developing brain. Is that something that is concerning to you as well, or what are your thoughts on that?
Well, I prescribe medicines all the time in my job. So I will say that I do agree that there's times that those are useful. However, we prescribe 80% of the world's stimulants, at least the last time I checked.
Wow.
Wow. So, America, and it's true with these other antipsychotics, with all these, we are very interventionalists. And to me, to my eyes, cavalier about how we prescribe things a lot of the time. I'm often, when I train the residents, I'm like, okay, when someone's adding on a third or a fourth or a fifth medicine, could we step back and consider maybe that medicines cannot solve this problem? And that medicines have failed, right? Wouldn't that be a more reasonable thing to at least consider than yet another medicine is going to solve this problem? And so, unfortunately, yes, we have a very interventionalist system. We build our models about like, hey, click off the diagnosis. Okay, what medicine goes with that diagnosis? So we oversimplify things. I mean, your brain with, 80 to 100 billion neurons and 120 trillion connections. I mean, it's the most complex thing in the known universe. And do we really know what we're doing when we come in with these interventions? I mean, no, we don't. And so, yes, I share your concern, and that's, been for my whole career. There's been part of my message is to be humble about what we know and don't know, and be concerned about iatrogenic damage that we could be doing. Even our models.
Can you define iatrogenic, please?
Excuse me. Yeah. So that's medicine caused harm. So when the medical system or medicines that we prescribe or surgeries we do, anything that's medicine that causes harm, that's called iatrogenic from the Greek. So.
Oh, thank you.
Yeah. So that's like, and people have been talking about iatrogenic damage in medicine for a really long time. It's been part of our tradition to sort of try to figure out what are things that help people, what are things that harm people, and what situations are more likely to cause iatrogenic damage. And there are often situations where we can kind of get something that are like, oh yeah, we get a little, 8-week study of a short-term benefit. And, a lot of times that's how we approve our medicines is a 12-week studies, 8-week studies, something like that. But then we leave someone on these things for years. So we've never really studied being on these things for years. We don't really know what the potential outcomes are. And of course, since we have these dynamic biological systems, wouldn't it be reasonable that some of these systems will then adjust to the medication over time, negating the, just basically down regulating your receptors for anything that you're blocking? And then in the long run, are you really getting a benefit? Because you also can look at the trends, and we're prescribing more and more medicines, yet we're having more and more mental health problems. So it doesn't seem like more medicine, we can't medicate our way out of the mental health crisis, at least in my opinion. I think it can, medicines can help people, and there, you need a sophisticated viewpoint to piece out when medicines are appropriate. But yes, we've set up a system that uses way too much and is way oversimplified, in the leaning towards extra medicines that we don't need.
Yeah, I remember watching a documentary about Teddy Roosevelt and how hyperactive he was as a kid. And, he was a person of means. And so his family found activities for him. He got to go hunting and had, all sorts of opportunities. Same with Winston Churchill. And I wonder about, if they were born, in 2000 and they were growing up today or whatever, like what kind of medications they would have been on and what kind of lights those medications would have extinguished. Because I don't think either one of them was very good in school.
Mm-hmm. Well, and we're not people in a previous era accepting of the child, wherever the child was, that's fine. And we don't need to optimize our third graders or seventh graders or make sure, the amount of, and this hovering is really about the parents. It's not about the kid. So we need to be able to back off more and the kids will work this stuff out over time. And a lot of the parents who are helicoptering and getting too involved and all this need to back off, although it's really hard because, for one, as you have noted, our institutions we're having trouble trusting them now. So it's hard to tell people to back off when they're concerned about what's happening at their school. So right. I hear you that's not easy. The other thing is we have new risks because this is the biggest generational gap that the world has ever seen. And so if we do need to worry about stuff, it's not about physical safety though, right? We need our kids out exercising more, even if they do, scrape their knees more, even if they do get hurt a little bit, they need to be out there exploring the biological world and moving their bodies. But the online world is more their risk today because we've had a loss of traditional cultures, religion, things that just transmitted how to live, and we're a hyper social species, and kids are soaking up and they really don't care that much about what their parents or other adults think. They always want to be, if you heard of Judith Rich Harris and her group socialization theory, kids are always competing in their world for a place in it and trying to figure out where they fit in their world. But their world is now very influenced by what comes through social media and electronics, and very much less influenced by traditional things, which may have been built up for 1,000 or 2,000 years. A lot of this stuff for hundreds of years, because it worked, and because we don't always know why culture works. But the things that keep often have some unknown wisdom in them. And we do need to change all the time. And it's hard to tell what, but we do need to be careful about throwing out stuff from our culture, because it took a long time to get there. And we always think we know better. But do we really?
Not really an improvement. I've said for a long time that we've lost intergenerational knowledge and exposure. Families used to live with grandparents and aunts and uncles and larger, more elderly, more, intergenerational connections. And these children who spend the entire day looking at screens, and then even disconnected once they come home, still looking at screens, miss almost everything.
And what are they getting through the screens? A lot more stuff from other kids, or like kids always like the people who are a little older. So it's usually, not exactly maybe the same age, but if you're 12, you're really looking to the 15 and 18-year-olds. If you're 8, you'll look into the 12 to, so you're always kind of, but we now have that information flow kid to kid, and it's much more likely to get a lot of unwise modeling and flow of information, right, from other kids than it would be if they came through schools and religion and parents and grandparents and the other neighborhoods and the traditional ways that kids were enculturated. And
there's no context. It's like all these ideas are just like, coming out of thin air, but there's nobody to my concern about non-evidence-based gender approaches is that they're just being done with people who mean well, but don't actually try the most obvious thing, which is bring that girl to her grandmother and have grandma talk about what it was like to go through puberty 70 years ago, and how much she hated her breasts too. Like, there's nothing like triangulation, but there is no triangulation because it's like the media and the influencer and the charming rainbows everywhere. And it's hard to fight against that. So I guess on that note, institutional capture has left us really alone in terms of finding medical practitioners who we can work with and trust, and especially mental health practitioners. And you and I were talking about this a little bit before the conversation. What do you recommend for parents who are seeing these signs amongst their children and really are struggling with who to trust and what to do and what kind of help to seek? What can you recommend?
For one, if you do need to find a therapist, there is a GETA, which is the Gender Exploratory Therapist Association. So that's a group that has, if it's a gender-related thing and you want to find a therapist who's not going to jump into affirming and is actually going to try to have some depth in their therapy. So I think that's a great organization. In terms of what to do, I think for one, parents should trust themselves to understand what's going on and stand up to people who are trying to tell you they know better about your own kid. I think this has been a really shameful part of this whole gender ideology, is that, I'm not saying it was ill will, but it pushed this concept that somehow teachers and people who are, friends of the family and other, they know better about how you're supposed to parent your kid. And that if your kid declares something gender related and you don't parent the way they think you should parent, then you're the bad person now, and you should be ostracized and you should be treated. So I'm like, no, I have to tell you, they did do a system. It's not published yet, but they did a systematic review, the Society for Evidence-Based Gender Medicine. But we had a presentation on it about affirming, about social transition. So social transition is a data-free zone. Like there's no research there saying that that is good for your kid. So if you don't believe in it, don't let people pressure you into doing things that you don't believe in. If you believe in it and you think that's good for your kid, then do it, But if you don't have to, and they can't show you really any data that's helpful. And so, sadly, the advice that I would give is if you can find an older, certainly like, most psychiatrists that are old enough had whole careers where they never had any of these gender dysphoric kids. So they're very unlikely to really just buy into this. Like this is the only way to solve this problem with a new cohort that never existed, that they practiced for decades and never saw, and now they're supposed to do this gender affirming. I mean, I think that that's for one way to find a professional who's, going to get it a little bit more. They're less likely to believe the hype. I think avoiding professionals also can be, a wise strategy, because what we really want to do is if someone's like very over concerned about gender identity and gender issues, it to me strikes that they don't have enough other things in their life, and they need a broad, so to the degree possible, we want to get our kids to be, involved in sports and music and fun things and, leisure pursuits and academic interests and those type of things. And so I think just trying to try to create a culture of excellence in your family, which includes all these things, is a way to kind of get the conversation away from gender. And then over time, it probably will just die out. I mean, that's the hope. And I think that's probably what will happen for most of these kids most of the time, because the reality is this is the first generation and really the only generation that's had this adolescent onset gender issue in mass. And obviously, therefore, it must be sort of created by the society. It's not a inborn thing in them. And I think once they grow up and see the world and go through their puberty, that a lot of this stuff will just get worked out. And I think it's to some degree a reaction against traditional gender roles. And I think it's fine. We can let gender roles have a wider expression. I mean, to me, as long as you're not, pretending things that are not true and not medicalizing the kids, that's fine. I think that wider gender roles, that's a legitimate discussion to have, and we need to figure out how to be inclusive, right? And that is an important part of this. So I wish I had easy answers for parents, because it's not easy.
Well, I think trust your gut and talk to your kid and spend time with them and crowd out the social media influence with actual real life experiences is very good advice. One of the things that we've been talking about at Restore Childhood is the importance of exercise. Exercise changes everything. It's a natural, drug, and helps with mood regulation, and obviously helps you keep at a healthy weight and good muscle tone, things that live with you for the rest of your life. But also, I think once you participate in a team sport and have a coach, that's another mentor. We've been working on a documentary on the school shutdowns, and some of the most interesting people we've spoken with are coaches and their experiences both before and after the pandemic, and how they were able to reach their athletes during, the time when gyms were shut and, playgrounds were shut and schools were shut, and how vital that connection is. And also the accountability, like you need to actually show up. It takes a lot of time. It's a lot of practice. And you have this infrastructure, this team that's working together towards a common goal, shepherded by somebody who believes in them. And I think that, anecdotally, I think you probably don't see as much of the dysphoria amongst these people who are struggling.
100%. I mean, I believe that sports and really any group activity, being in a band, having a common purpose, sorting out where you are, what skill set you have as a kid, and realizing like, okay, and where does society, have a niche for this? But I'm constantly preaching exercise too. So I mean, kids have to pound their bones during their adolescence. That's how you get strong, and we need to let them fail. That's a part of life and part of sports is you lose. You people are better than you. You have to accept, and then you need to work hard in order to improve your skills. And that's great preparation for life. So 100%, the more sort of sport. I mean, I think unfortunately, as time has gone on, there's been a professionalization of kids sports, which has made it harder, especially for disadvantaged kids, to be in sports as much. And sports is, it has become very like do one sport intensely rather than doing lots of different sports, which I think is even more healthy, because if you change season and maybe you're good at one and then you're a role player at the next one, and maybe you're really bad at the next one, but then you can do good, and so through the years and over time, kids get to play lots of different roles, but also for their bodies, it's just great for them to do a diverse set of things. And so, I hope that we can kind of keep increasing the amount of sports people do, but also like take down this whole, like, you need to do this in college and this is going to be your profession and all that kind of stuff, and let kids have a diverse set of sports with a little bit less intensity than some places are sort of pushing on them.
I love that you said that, because my 9-year-old is obsessed with soccer, but she's not on a professional team, and she goes once a week. But then there's also the gymnastics and the running and some other things that she does after school. And she said, next year I want to do like all soccer. And I'm like, I don't think that's a good idea.
Well, you're a great mom.
I also listened to Emily Oster talking about her book of about a year ago, and she was talking about how whatever you choose for your child shouldn't be just with like an end in sight, but also like what fits in with your family values. And the family values are, we need to have dinner together every night, as often as possible. Say 5 out of 7 is good. We need to have a conversation about your school day. We need to do some outdoor activity, hopefully weather permitting, and moving and diversifying your friendships and everything. That all works very well too, without being too overscheduled. So, she's one of the kids who has like a lot going on in different areas, but then other kids are like on soccer teams and there's a practice every day. And so I see the value in that too. They get very good.
Yeah. I mean, and in every family and every kid, is different. So people work out these things, but I think being mindful of some of the traps of even, we need everyone exercising. We need everyone moving their bodies. And, there's this idea from Katie Bowman called nutritious movement. I don't know if you've heard of Katie Bowman, but I love Katie B. She's really good. So but she talks about nutritious movement, and it's, moving every part of your body. I mean, all these parts are necessary, especially while you're developing them. And we sit kids for way too much, which of course like tightens us up and contorts us, and then, and leads us to think that that's normal. And it doesn't launch people into adulthood they're already having back problems. They're already, not the way that they should be at the strongest part of their life. And back to the pounding the bones, you got to use all that stuff to have it be how it should be. So that whole nutritious movement idea, I think, is really critical. And, that's a concept. It's interesting how medicine it fails to, on so many levels, it's failed to take up reasonable and smart actions that would be good for the population. And I think just moving that concept forward of nutritious movement, because, no one's out of shape. We're all in the shape we should be in based on how we live our life. So, this is right.
Really great. Well, I think that probably on that note, we can adjourn, unless, is there something else you'd like to share with our audience?
Yeah, I mean, I think we covered a lot of great stuff, and I just would emphasize that we probably really need a group effort to reform our public dialogue, to move these institutions along. So I think the more people can get involved in a productive, I don't want us to, we all have some tribal tendencies, and we want to, we see things that are going wrong in the world that upsets us. We want to change them. We also, though, don't want to get in another tribal battle. We want to have a way forward where we constructively can talk with people who we disagree with. And I think reason will win the day, but we just have to be engaged and be willing to, talk this out and demand that we do have a conversation.
Words are so important. Words are not violence. They're
No.
words.
Yes.
Violence is violence.
No, totally. And I actually meant to say this before, but I'll add this. Part of our problem has been our level of prosperity. And basically, we've been very free with the great peace. I mean, we've had such freedom, such prosperity, and such little war. And now a lot of bad things are happening in the world. And this is really a serious reminder of how, the stakes are really high and things can go really bad. And so I think, we all just need to take things seriously and work stuff out. And hopefully we will avoid future conflicts, because there's a lot of tragedy going on right now and it's not good.
Wise words. And I think that we're going to leave this, in a very optimistic place. I think trust your gut as parents, talk to each other, make time to have conversations if your kids are young at the playgrounds, if they're older, like on the field with other parents. No conversation in person is as polarizing as social media. It's so easy and it goes so fast. Real life with facial cues and, the environment is just different. It's a different experience. So whenever possible, talk. And I hope that your voice is heard in more publications and professional organizations, because it's so reasonable and so compassionate, and it's important to have you. So thank you for joining us, and thank you for speaking out.
Well, thank you for having me.